local expert for wealth management, tax, accounting, and payroll. Thank you for voting us Yuba Sutter's best in multiple categories, including financial advisor and wealth management firm for the past 5 years. You can find more information at shawassociatesinc.com or 530-674-1150. Shaw & Associates is proud to support community radio.
And in with me right now, I've got Leah and Sarah from the Sutter County Office of Public Health. How you guys doing? Did I say that right?
Sutter County Public Health.
Sutter County Public Health. Just that. So let's get to know you guys. Let's start here with Sarah. Sarah, where were you born? Where'd you grow up? How did you get into doing public health and all that good stuff? So,
hi. So I'm actually a lifelong Yuba Sutter resident, and I've been with Sutter County Public Health for about 15 years. I'm a public health nurse supervisor, and I supervise our children and family services programs. I ended up in public health after nursing school. I just wanted to do something different than acute care, and so I looked into public health and started there and just kind of found my niche. I love public health because I get to provide early intervention services and a lot of preventive services to our most vulnerable populations, which is infants and children. And I just feel like that's so rewarding because it's a huge investment not only in the individuals and their families, but also just our community as a whole.
Yeah. So what do you do specifically for public health?
So I oversee our programs for children and families, and I don't know if you want me to get into all of that right now, but
well, what are some of those programs? What are the names of them? And so
okay, we have our maternal child adolescent health program. We have a California Children's Services program, a healthcare program for children in foster care. We have a Healthy Family Sutter County home visiting program and a childhood lead poisoning prevention program.
Okay. Lead poisoning prevention. I think that's kind of a little important there, right? So Leah, let's talk to you. Let's get to know you. Where did you grow up? How did you get into public health? What have you done, and what do you do for the county?
Sure. Excuse me. So I grew up in San Diego, born and raised, and ended up coming to this area, the Sacramento region. I was recruited for a job out of college and worked for the state of California for 20 years. Mm-hmm. And 9 of those years I worked for the California Department of Public Health, and so that's when I started in public health. And what I really enjoyed about public health is it just touches on so many different sectors. It touches everything. So it's just kept me interested. There's always something new, a new issue to work on and think about how everything I do, it really helps, individuals, families, and the community as a whole. So it's just always kept me excited and interested to be working in public health.
And so in order to work in public health, do you have to be a nurse or have some sort of nursing type of degree?
No, my degree's in public administration. There's also many people have a master's or bachelor's in public health. Many nursing employees, and so nurses play an integral role in many of the public health programs. But there's also health education specialists, intervention counselors. We have many support staff, nutrition assistants, dietitians, social workers, epidemiologists play a key role. There's so many different staff levels in terms of education experience. So you don't only have to have like a public health degree or a nursing degree, but so many different ranges of experiences that can that work in public health and help the community.
Nice. So what do you do working in public health?
So I'm the public health branch director, and so I oversee all the public health programs in the branch. And I see my role as really supporting all my staff that are really the experts in their programs and giving them all the resources and support they need to do all the great work that they're doing.
So how many programs are there in what you guys do in the field?
There's so many. And so also, John Flo will come in a couple weeks with some other public health staff to talk about some of our health education and promotion programs, and also our we have prevention and early intervention for behavioral health, which is both Sutter and Yuba. That's
right.
Also within public health. We have homeless services programs, emergency preparedness. We have an epidemiologist who really looks at all the data and shows just really identifies the needs of the community and kind of our health status. There's so many different programs. We do also all the birth and death records, the vital records.
Okay.
A myriad of different programs.
Yeah, it sounds huge. Like Sarah, you were talking about. It sounds like you are involved in about 10 or 12 different programs just yourself, maybe even more.
It's actually 5, I think.
Is it 5? Okay.
But if you want to say 10 or 12, that's
It
fine.
sounded like there was a
Feels like
litany.
10 or 12.
Yeah. So yeah, I mean, and you're working with families and with children. What brought you to want to be working in that sector instead of something else?
I've just always enjoyed working with that population. Again, I really feel like, working with children is such a huge investment because they are truly our future. And I also really enjoy working with parents and helping them. Parenting is hard. And so giving them the support and resources that they need, especially for parents that are experiencing specific challenges. So that could be families that have a child with a special need. It could be a mom struggling with postpartum depression or an anxiety disorder, something like that. So that's kind of where all of our programs focus, is on those special situations.
Right. And so when you find a family that has a special need that they need, what kind of needs are they? Are they physical needs? Are they mental needs? What types of needs are you focusing on?
So they can be any and all of those things. So our California Children's Services program, so it's part of a statewide program for children with special health care needs. We case manage over 800 medically fragile children from newborn up to age 21 with certain medical conditions like cancer, heart disease, vision and hearing loss. It's part of actually a statewide program that covers payment for medical treatments like surgeries, medications and tests, things like that. So part of that is case management by our nurses, and our nurses are really good at what they do.
Right.
And basically, they kind of help connect families. They bridge the gap. Not only do they work through that payment process and authorize those payments, but they also provide the case management piece. So, for example, you have a child that is recently diagnosed with a serious medical condition, and they can't get into a specialist because the specialist doesn't accept their insurance.
Right.
So our nurse case managers will work with the families, the specialists, the insurance companies, and make sure that those kids get to their appointments and see the specialists they need. They also help with medications and equipment. Like, we've had situations where families can't get a wheelchair for their child that desperately needs a wheelchair. And, it's just a vital part of the way that this family is going to function and get through daily life. And so, when the primary insurance might deny the wheelchair, our case managers will go in there and they'll work with the family, the pediatrician, the specialist, the vendor for the equipment, and make sure that whatever needs to happen happens.
So how do you find, or how do the people find you guys in order to make these things happen? Because I can see somebody who's feeling like they're left alone because they need those types of things, and they're like, what do I do now? How do I go forward in order to help my child?
So for that particular program, oftentimes the referral comes from the provider, like the child's pediatrician or the hospital, but families can self-refer. So if there are any families that think their child might qualify, they can call the health department and ask to speak with CCS or California Children's Services, and we can help determine eligibility.
Gotcha. And Leah, so breaking into what you do, being an administrator essentially, of trying to cover all these programs, how do you handle that workload of, okay, you're here to try to take care of all the cases that you guys have?
It's really dependent on the great staff that work for me in the county. A lot of what I want to do is support the staff and make sure they have all the resources and everything they need to run the programs that they're experts in. And there is a myriad of different public health programs. And, I couldn't do it all by myself. It's really a team effort.
So how do you find, which program's going to work best for the people that are coming in that need that assistance?
So a lot of it is looking at, what are the health needs of the community. So with different funding sources and grants that come from the state or the federal government or from other sources, is this a need in the community? And so, looking at what that need is, and then seeing what are the interventions that we can do to either keep people from getting sick or give them the tools and the education and the resources to be as healthy as they can be. And so really looking at what programs will serve those needs that are in the community.
Gotcha.
So we have a maternal child adolescent health program, which is a grant through the state. And in that program, we provide, just within that one specific program, we provide a wide variety of services to families with young children. So we have a safe sleep program, and the purpose of that program is to reduce the risk of SIDS, sudden infant death syndrome, for infants in Sutter County. And people may not know, but SIDS is actually the number one cause of death of children in the U.S. from 1 month to 1 year of age. So we provide one-on-one education, sleep sacks, cribs, and information to families so that they can follow the safe sleep practices that are recommended by the American Academy of Pediatrics. We also provide breastfeeding support. We have nurses that have education in lactation support, and so we can provide those services to families. We also have services for moms suffering from perinatal mood or anxiety disorders. So those are mood and anxiety disorders that occur during pregnancy or after birth. Our nurses are trained on mental health support, and knowing that perinatal mood and anxiety disorders are the number one complication during pregnancy and childbirth, we provide that support free to all Sutter County residents, regardless of income and insurance status. So those are some of the things that we do with the grants that we get.
Yeah, and that's a really good example. The perinatal mood disorder is, the state was seeing a rise in these kind of issues and the ramifications that the mood disorders would have on a mother right after giving birth. So then it's, with a state and local effort of, we're identifying this need that is rising and rising. So what are the different activities and the funding that is needed so we can help address the issue?
And actually in Sutter County, we have higher rates in the state for
Really?
perinatal mood and anxiety disorder. Yeah, so California statewide, it's about 1 in 5, but our local data kind of shows that number may be higher among our new moms.
Oh,
Yeah.
goodness. That's crazy to think about. It's like, oh, man. I have 4 kids of my own. They're getting older in years. They're not grown yet, but they're not like infants or toddlers anymore. They're all in school and things like that. And I remember when our kids were born, just that trying to adjust and the difficulties there and trying to figure that out, it can get very, very depressing, and you can feel very, very alone as well. So, I mean, that's a great thing to look at and to try to help maintain mental health. What's one thing in our area that's focused on, like post-pregnancy mental health, of what's going on in our area? What's some of the big things that you guys actually focus on?
So we have a Healthy Family Sutter County home visiting program. So this is a long-term service that families can receive. It's part of a nationally recognized home visiting model called Healthy Families America, and it's actually an evidence-based model. We're one site of 600 nationwide. We're actually currently going through our accreditation, which is the first time we've done this, and it's exciting. The national office is coming to Sutter County on site to review all the work that we've been doing and give us our accreditation status. So we have home visitors that have been trained to give parents the support they need to adjust to parenthood, like what you were talking about,
Right.
and learn how to nurture and care for their children, learn how to cope with the stress of parenting, and get connected to those vital services in the community. The nationally recognized model, Healthy Families America, the goal is really comes down to just preventing child abuse and neglect. And we do that by making sure that parents really bond and attach to their child by having all the support they need to do that. The model has been proven to have give improved outcomes in things like school readiness, maternal newborn health, so like those perinatal mood and anxiety disorders we were talking about, prevent child injury and maltreatment, reduce crime and domestic violence among these families, and improve family economic self-sufficiency. And that service starts prenatally or early postpartum period, depending on when we get the referral in the family, and it can last up to the child's 3rd birthday. We continue providing those services.
Nice, because I mean, that's one of those things. Once you get into the flow, it's not as big of a deal. But trying to get into that flow and understanding the changes as the child is growing up, and like those first 3 years, your child changes so much, right? It goes from just you need to hold it, you need to feed it, you need to do everything for it all the time, to it's trying to figure out how to be an independent person, essentially. So, and where the limits are. So,
And research shows those first 3 years of life are the most important. You know, those are the foundational years that really determine the outcomes for lifelong outcomes for those children as they become adults.
gotcha. You know what? Our time is up. I told you guys this would go fast, and so
Wow.
believe it or not, our time is up. Is there anything else you guys would like to add before we end our interview?
You know, I just want to highlight the great work that Sarah and the staff under Sarah and the programs. The home visiting program is just one great example, and we're really excited for accreditation. But it's a program where, you know, we were really seeing this need of home visiting and being able to start the program. It's fairly new. I believe we started in 2019. And, you know, we're looking to grow it because we really do see the need and how much it helps the families and the community as a whole. So we're really excited about the program and all our other programs that are under Sarah and within public health.
Awesome. Guys, thank you so much for coming
Thank
in.
you.
Leah and Sarah with the Sutter County Education, or not education, sorry, Sutter
Public
County
Health.
Public
Public
Health.
Health.
I'm talking about educating all of us about how to help with our childhood, our children and their development, if I can get that out right. Goodness gracious. Thank you so much for coming in today.
Thank you.
Well, thank you.
This community interview is made possible by Shaw and Associates.
I'm Dave Shaw, President and CEO of Shaw & Associates. For over 65 years, Shaw & Associates has been your trusted local expert for wealth management, tax, accounting, and payroll. Thank you for voting us Yuba Sutter's best in multiple categories, including financial advisor and wealth management firm for the past 5 years. You can find more information at shawassociatesinc.com or 530-674-1150. Shaw & Associates is proud to support community radio.